Hello, everyone, and welcome to the Arthritis Action Podcast. I'm Marc, as always, your host, and today I'm joined by Caroline Flurey. Caroline is a chartered psychologist and associate professor of men's health and long-term conditions at the University of West England in Bristol. She's also trustee of the Men and Boys Coalition and member of Parliament's Task and Finishing Group for Men's Health. Hello, Caroline.
Hi, nice to be here.
Thank you for joining me. So today's topic is men and arthritis, which is something that we've not really covered specifically before on the podcast. So I'm quite looking forward to this one. But before we get started, let's learn a little bit more about you, if that's okay. So if you could tell us a little bit about yourself and your work with arthritis.
Yeah, sure. So I've been involved in men with rheumatoid arthritis for probably longer than I care to say now. It probably ages me a bit, doesn't it? So I've been involved in men with arthritis for quite a while now. My PhD focused on both men and women, just people in general with rheumatoid arthritis. And I unexpectedly found that men seemed to be struggling a bit more than women. They didn't particularly like the support that was on offer. So that took me into my postdoc work to focus specifically on men with rheumatoid arthritis. And I've since been looking at slightly more broadly at men with other long-term conditions or men with other rheumatic diseases specifically, and have students looking into all sorts of men's mental health issues. And so very much in the men's health sphere, but men in rheumatology is particularly my interest.
It is an interesting one. As not a man, why men as a specialty?
Absolutely. Well, very much the unexpected finding from the PhD was the why men. Certainly, I remember sitting down with my PhD supervisors, and it was very clear that was the sort of screaming finding that needed taking forward. And I remember sitting down and saying, "Oh, but men are a nightmare to get into research. Really, is this what we should focus on?" But it was just very clearly the gap in literature, the gap in knowledge, and the sort of issue that needed focus. And it's I've obviously just become more and more comfortable in that space, and as I've learned more, I've learned just how much more work is needed with men. So
by nature we are difficult. I probably shouldn't start off saying things like immediately giving men a bad name.
I'd say difficult. I'd say different.
Let's go with that. That's not. You're better at this than me. That's what we should be saying.
But I think that's maybe part of the issue, is that men are seen as difficult because they don't conform necessarily to what we think of as we see healthcare is delivered in a particular way, and healthcare is designed in a particular way. And a lot of that designing and development has often come from the more sort of feminine side of healthcare. So it's often come from the nurses or healthcare professionals, which are more often women than men. More often women speak up about the kind of healthcare they want. So unfortunately, inevitably, a lot of healthcare has been designed in a way that appeals more to women, and then we turn around and blame men for not seeing the appeal in something that we've sort of designed through quite a feminine lens.
That is a really interesting point. I know for many kind of health groups and things like that I've been on or taken part in, it's usually mostly women who actually take part in those, and when there are men there, they do tend to say a lot less.
Absolutely. And it's something that men have said to me is, so when they took part in my focus groups, it was all male focus groups, and they seem to really enjoy that. A lot of them said, "Wow, this is brilliant. I've never been in a group of all men before to talk about this." And some of them had gone to other focus groups or other support, and they were often the only man there. And one man said, "I turned up and I did my time, but I never went back," because there is it changes the dynamic. It's and I think we also see, we've seen previously in research, not in arthritis, but in other, in breast cancer research, we've seen that men, when they have, when you mix men and women, then men will tend to adjust the way they talk to accommodate women, which you don't see the other way around, but men will use the sort of banter or the way that they like to talk to each other. They will temper that to accommodate women, so they're then maybe not getting the support in the way that they would actually want to receive it.
That's really interesting. I mean, it's weird whenever you say things like that. I'm thinking like, oh, really? That is interesting. But then in my head, in the same time, that makes absolute sense.
Yes,
So I can completely picture that happening.
Yeah.
So I'd say let's start off with diagnosis, as we're going to go sort of like through various kind of stages and mentalities throughout this. So do you think there's a difference in how men react to being diagnosed with arthritis?
I think so. We know in the literature men tend to take longer to adjust and adapt to a new diagnosis. So the sort of development of coping strategies and self-management strategies tends to take a bit longer in men than it does in women. I think the response, so when you get a diagnosis, it's what impact is that going to have on my life? And potentially the things that men worry about are different to the things women worry about. So women often, it's maybe the impact on the family. Men often, particularly with something like arthritis, you're thinking about the impact on your job is probably the first. With family also as a consideration, but often it's a lot of the men that talk about low mood following diagnosis, it's often because they've had to change the way they're working, or they've had to quit their job because of, so often men in manual jobs, for example, that's often the big worry at diagnosis.
I think a lot of it does sound like it comes from almost like, again, there's going to be a lot of really generalized sweeping statements in this podcast, just to warn everyone about this. We know not, there'll be someone
going, worth the genders on a spectrum. So yes, very much talking about gender and masculinity, femininity, and not necessarily biological sex, which is another issue.
Yeah, so I think it's like there's that kind of traditional household unit of like, the man going out to work and then, woman at home with the kids. So I guess men in that situation especially would have it as like what's the word for it, I suppose, like as the breadwinner.
Yeah,
that's it.
Yeah. And certainly that identity as a breadwinner is really important. Seems to be really important to masculine identity. And there's a really nice study in men with prostate cancer that specifically asked men, when do you most feel like a man? And all of the answers were related to being the protector or the provider. So of course, if you've got a condition where you can't be, where one of those might be impacted, or both, the protector, the provider role, so paying for everything, being the one that does all the sort of being able to sort of be the strong one in the relationship, all of those sorts of are so intertwined with masculine identity that anything that challenges that, and of course being diagnosed with a condition challenges all of those sort of, particularly at diagnosis, you don't actually know what that's going to mean. So it's all the worries of.
So it must be terrifying to like have I actually have been I've got it in my lower back as well. So it is something I've also thought about as well. Like, will I not be, I'm quite a physical person. So am I going to be able to do these things in future? Am I going to be able to do that? I mean, it's definitely for some people, especially like some people I know, especially like the idea that they may need physical help from their wife or their partner or something like that would mortify some people, I think.
Absolutely. And men there's a quote from one of my studies of what was it? Now I've had to ask my wife to open jars for me, what kind of man am I? It's that, you should be the man's meant to be the one that the wife hands the difficult jar to open, and having to have help getting dressed, and that sort of emasculation of I think probably also worth mentioning that a lot of this sort of assumes quite heteronormative relationships, and gay men also sort of talked. I'm often asked, is that just straight men, or what do we see in gay relationships? And it was still sort of similar narratives. So even the protector provider role, there was still that you wanted to gay men wanted to uphold their end of that protector and provider sort of partnership. And then also in terms of the support, interestingly, and I didn't have maybe enough gay participants to be able to say, this is all gay men, just like this isn't all
of course,
but a lot of gay partnerships, they seemed to have more ability to read unspoken cues, and maybe something about men understanding other men there.
Yeah, that makes sense. Yeah.
There was a lot more of, it seemed more acceptable to accept support because they were providing it in a way that they wanted to receive it, whereas wives did a lot more of the well-meaning but not quite getting it.
Yeah. I suppose there's also, do you reckon perhaps there's not just in sort of a gay relationship, but also just in another relationship with a man? Like, do you think there's a more of a, it's a bit easier to accept help from another man than it is from a woman who's like, I guess maybe perhaps in their mind supposed to be quote unquote weaker or something like
Yes.
that?
I think well, it comes with its own challenges because men accepting help from other men, there's a masculinity battle. But so one man said something like, I'll ask for help, but I'll say, I've turned in my man card. Can you help me? So there needed to be some banter around it. There needed to be some men talked about almost masking it with bravado. So, for example, in the workplace, if they had a more managerial role, they found it a lot easier to sort of order people around to do things. So it's not asking for help. It's
Yeah.
I'm not ruining my health for this. You do that, you do this. Sort of. So it may be, but there was some positioning around it. And things like, for example, where if they needed help, I don't know, in the garden, they certainly wanted to pay for a service rather than, so then it was, then what they're providing, they're still being the provider, they're still
I guess there's a power sort of dynamic in that as well. They're still in charge of the situation.
Yes, still in control.
It's not emasculating at all. You've paid someone to do this for you.
Absolutely, yeah. And I think that sort of comes back to control is a really important, seems to be quite an important aspect of masculinity, an aspect of the men that coped best with living with arthritis seemed to be able to maintain some sort of control, whether that was because they were in jobs that had lots of autonomy or whether they had lots of control in the home or of but those seem to be the ones that were maybe able to accept the need to take care of their arthritis because they had all these sorts of other control in the rest of their life.
Do you think that men take arthritis like maybe less seriously than women?
I think that's a really interesting question because I think it would be really easy to say yes on the face of it. But I actually think that it's maybe that men's behaviours seem as though. So I think the behaviours.
They're more like a coping mechanism to kind
of
brush it off instead of like openly dealing with it.
I think they deal with things. So, for example, men will use banter to talk about difficult topics, which of course is going to give the impression that they're not taking it seriously because they're just making a joke out of it. But actually, underlying some of those jokes is, one man said, I'm going in for surgery. So my mate said, can I have your drill if you don't make it? But underneath that is the worry that I'm going in for surgery. What if something happens to me? It's the, so I think there's an element of them taking it seriously, but maybe masking that because they shouldn't be seen to be taking it seriously. Men do a lot of information seeking, which I think does indicate trying to take things seriously. So a lot of men talk about trying to become experts. One man said, you've got to treat it like a job, talking about managing his condition. So there was, so I think there is an element of taking it seriously, but it's within this, I still need to put on the face of men don't take health seriously. So I think underneath it, most of them actually do take it quite seriously, and they all seem to know, all different tricks for how to manage things, or they all knew the names of all their medication, and they know what they're talking about. They are often experts in their condition, but
I have found that, especially through people we've encountered through the charity, that a lot of men will tend to look at, like, examine our resources more. They want that information on their own in private, and they'll go through it all that way. And like I say, probably go through it with a fine-tooth comb and become very proficient in the topic. But a woman, again, general sweeping all the time on this one, so please don't come at me. But
Absolutely.
but I think the women would be more likely to engage in a group or a call or something like that, and like, if, oh, what do I do? Can you tell me all the things? Where can I get support and things like that?
Absolutely. And I think, men very much wanted things at their own pace and in their own time. There was often I remember in one of my focus groups, almost a competition of who'd got their information from where. And, there was, well, I read this in the Lancet and I read this. And, there was a sort of, so, yeah, I think it's this constant battle with there's the sort of element of masculinity of men are the experts, men know best, men don't need to ask for help. And then men don't really take care of their health, so I shouldn't really be bothered about this. But actually underlying that, I think most of them do, whether it's positioning themselves as an expert or whether it's positioning themselves as somebody that doesn't really bother. I think in their own ways, they do take it quite seriously, whilst balancing that with all the other things that, so men may prioritize, for example, their jobs over looking after their health, but it doesn't necessarily mean that they're not valuing their health. They're just they're very aware of the consequences, and the priorities just might be different at that time.
As you've mentioned a couple of times about, we've discussed this already now about how, men will use humor and things like that while talking about it, which is something again, yet another thing I can completely understand. And I probably do that myself as well. I almost certainly do that as well. If I'm talking about anything serious, I will make a joke about it.
Absolutely.
So it's
And I
just,
think a lot of it isn't just because we also make the assumption they're doing it to make it easier for themselves. But actually, I think a lot of them it's to make it easier for the person they're talking to. And I want to tell
yeah,
you this awkward thing, but I don't know how to do it without making you uncomfortable. So
that's definitely sort of range true with me. But I was wondering, like, as we said, men have like more of a reputation of not being very open and not talking. And like you did mention that they kind of a bit different when they're talking with other men. Like, is that sort of just a bit, not necessarily a better way to do it? Or have you found that's a more effective way of men kind of discussing these things?
yes, I mean, definitely. I think so. I did ask men, would you, do you prefer mixed groups or all men? And a lot of men will say, actually, I don't mind whether it's all men or mixed groups.
Mm.
Difficult to know whether that's because I'm asking them as a
I
woman.
was going to say, do you think they actually mean that?
So when I've really pushed them on it, that's when they will say, so push them in terms of, do you think you'd have talked about the same things that we talked about today if there'd been women there? Then I'll get oh no, maybe we wouldn't have said this or this or this. In theory they don't mind, but actually in practice, I think also there's the idea that if it's an all male group, they know they're coming and it will be all men. Whereas if it's a mixed group, they don't know if they'll be the only man there, which is probably a previous experience. So
Can be a worry for some as well,
it's
something like that, because some men don't like doing like, or at least showing
no,
any signs of weakness or anything like that in front of women. Some people do have a very traditional view as to how a man should act.
absolutely. And that those sorts of supportive spaces are for women, and I won't go and encroach on that. And if I did, I'd have to be, yeah, absolutely. I think so. Certainly in my focus groups, there's certainly across the literature in all sorts of other conditions. If men have really talked in all male focus groups. I have done interviews with men as well, and they also open up in those. I think you perhaps get a bit more, interestingly, I think you maybe actually get more openness and more emotional openness in that group of mixed men, because they will bounce off each other. And once one starts to say, actually, I really struggled with this, then it almost becomes a sort of competitive environment of who's struggled the most. Like men will always compete, whether it's who's the toughest or who's the quickest to cry. So I actually think that dynamic of so there's a sort of theory that men bestow masculinity onto other men. So if a man says it's okay to cry, then men are more likely to take that than women saying it's okay to cry. So I think there's something about that power of the group. The more people, the more men that are opening up, the more it's normalizing that men do talk. And
there's also, I guess, the seeking of approval thing for other men as well. Like, oh, like, yeah, the other guys are into this. That's good then. So that's fine. They're all right with this. I can do this.
Absolutely. And you see the checking of, oh, I had this symptom and it was really hard. Oh, you found that too, did you? And there's almost that, yeah, that validation of, oh, it's okay to say that this is really painful because everyone else is. this may, I found this really difficult.
How do you think this applies generationally? Like, for example, my dad would be far less open than I would be. And I imagine, like, if I had children, if I had like some like 20-year-old son, I imagine they would be perhaps a little bit more open. Is that something you found with your research?
I think, well, it's an interesting one because I would certainly make those assumptions as well. And I would think that, and when I talk to younger men, I see them as being more open. But there are still quite a lot of barriers to young men opening up as well. There was, so it's fairly old now, but there was a study, it was funded by Kleenex actually, that asked lots of men across multiple generations, when did you last cry? And they also did focus groups or interviews, and they talked to the men. And the men across all the generations, the younger men were the ones that were much more accepting of other men crying, whereas the older men were more, men should man up sort of attitude.
Yeah.
But when it came to asking them specifically about their own emotions, so when did you last cry, then the younger men were just as unlikely to admit to having recently cried as the older men. So we seem to be seeing this shift in acceptance of other people's emotions, but we're not necessarily seeing that completely yet translating into their ability to open up themselves without sort of permission. And
it is a shame that I do really wish that more people would be a bit more. I cried last week. I was watching telly and it really got me, and and it's all good.
It's totally normal.
Yeah, I wish that more people would be a bit more open. I think that's a stigma that's definitely disappearing a bit more these days. I think people are more open to it and will say things like as I just did then. Like,
absolutely, I think, and I think again, it's you may find that the more you hear other people saying, yeah, I just cried recently, then it becomes more normal and more, and having those role models, the sort of people that you think, oh my gosh, if they cried, then it must be, if someone like that cried, then it's okay for me to have cried also probably makes a difference as well.
Role models can there can be very positive role models out there, not just especially when we're talking about masculinity or something, there's a lot of that around. I don't want to go too much into that today, of course.
No,
that's a whole other topic that I don't but I mean, there are different types of role models even throughout masculinity as well, and I think it's really important to embrace the better side of it as well.
Absolutely, yes, definitely. And I think it comes from just probably worth a shout out to Lads Needs Dads, which is an organisation actually recently featured on the One Show, but an organisation that provides male mentors for young boys that have that don't have a father figure, whether that's bereavement or whatever the reason might be, and it's just purely to provide that sort of male role model in their life, sort of positive male role model, and they have really great success with that. But yeah, so there are people doing good things.
Yes, of course. Yeah, there's loads of people doing wonderful things. We're not giving. I don't want to give all men a bad name throughout this. There's lots of you are wonderful. I'm not talking to you if you're worried. But let's bring it back a bit more specifically to arthritis now. So, what are some of the more unique issues that men find with arthritis than women, do you think?
I think so. Any kind of gendered situation, I suppose, is probably so. One really nice example, I think, is the handshake is a real sort of of course women shake hands as well, but there seems to be something about that power dynamic when two men shake hands, and men with arthritis have talked a lot about how they cope with that. And you shake someone's hand and there's often a power play, so they'll hurt, it will hurt to have their hand shaken. Some talked about doing things like, I just go straight in for a hug and a pat on the back. But there was one man talking about if he goes into a business meeting and he can't shake the other person's hand in a sort of firm enough way, then he feels he's instantly on the back foot in that meeting. And I don't think women experience that in quite the same way. It's important for me to shake someone's hand, but I don't think you experience that quite that same feeling of
Yeah,
I'm
some people.
already emasculated before I start.
Yeah, some people really do use that as a like a method of dominance. To when they immediately meet you, they will try and crush your hand within an
Yeah,
inch of its life. And
which
I've
again
done.
they don't do quite the same to women, I don't think.
No, no, I'm sure they've got other ways to do
Yeah,
things like
oh,
that.
I'm sure.
Yeah,
Yes,
yeah.
yeah, but it's a
There'll be other.
very
There'll be
two-man
other.
interaction, isn't it?
Yeah,
That handshake.
yeah. If it's man on man, there's some people do. I mean, there's that sort of view of like, oh, you can tell a lot about a man by his handshake,
Yeah,
which is again a really
yeah.
old school masculine thing. Whereas I couldn't care less about what someone's handshake's like, really. I'm more interested in what you got to say. Maybe I'm a terrible example of classic masculinity, which I
That's
definitely
probably
am.
helpful.
But
In fact, when I started in rheumatology, because I've always grown up with that as well, of the you hear that, don't you, as you grow up, the idea that you can tell a lot about a person's handshake. And I remember whenever I'd meet a rheumatologist, I started noticing why their handshake's always so weak. And of course it's because
mm,
they're used to shaking patients' hands, and they never know who they're shaking hands with. But yeah, I think
that's really
it's nice
interesting.
to see that that they actually do that.
Oh, can you imagine if they didn't? Oh,
Yes,
everyone would be dreading going to their dog. Like, it's going to
yes,
crush my hand
absolutely.
again. Oh
Yes. But yeah, I suppose other sort of gendered situations is, we've touched on the breadwinner
no. Yeah.
role. I suppose that, that's a big something else that I think is really worth talking about in terms of gender is the mum, dad, so the father role or grandfather role.
Yes, we haven't covered, yeah, sort of parenting and stuff. That's definitely going to have a big effect, isn't it?
Yeah, and I think, I mean, obviously, when you talk to women, they also worry about the effect on their parenting. So I think, that's genderless that people worry about how it affects their parenting. But the way that it affects parenting, dads very much see themselves as their role as a dad. They often talk about, dads are meant to do the physical play with the children.
Mm,
Dads are meant to crawl around on the floor with them. They're meant to kick a football with them. They're meant to play video games with them. They're meant to, all of these gendered expectations that I guess society has to a point, but that these men place on themselves of how
yeah.
if I'm a dad, this is the type of dad I should be. Again, a granddad, similarly.
Yeah, it's a generational thing, isn't it? Because like I know my granddad would have done. We're from a rugby family, so that'd be even worse.
Yeah,
But
it should be dad, not mum, doing that is the assumption.
yeah, so I know like his dad would have done it, and like then my dad did it, and like I think it will go down generation. It's like that's what you were brought up with, and that's what you were taught. So
Absolutely,
there's
and
that
I think
idea
there's
that
a
your
lot
job
of
is now to fulfill that because it's your turn to do it.
exactly, yes. So um there's the loss of I'm not being the dad. I'm not passing on that legacy. I'm not teaching them all
Mm,
the things that I would want to teach them as a dad. So that sort of loss. But then there's also the how do I be a dad? Because there's that feeling of failing them because I don't know how to parent. Mum does the cuddly stuff, dad does the physical stuff. If I'm not doing
mm.
the physical stuff, how do I parent? And there seems to be a lot more help for how mums get around the maybe no, maybe that's unfair to say. Maybe women with RA would with arthritis would say that's not accurate. But I think from a man's point of view, mum can give a child a cuddle, and they're doing what they're fulfilling that parenting role of the nurturing.
Because you can
Whereas
nurture not necessarily physically as well. You can do it without,
yes, yeah,
for lack of a better term, as much physical effort as like going to play football or doing something like that with them.
absolutely. And a lot of men will say, I'll sit and read with him, but then it's often caveated with, I will sit and read with them, but I wish I could be doing this with them. So it's
Mm,
there are ways that they learn, they are finding workarounds for how to be a good present dad without doing the physical stuff. But I think that is a big gendered part of a sort of loss that comes with arthritis. I think is that, the vision you had of what a dad looks like.
that kind of like sort of leads on to the thought of what do you think are like some of the factors that will like make a man do something about his arthritis? Because I know a lot that will ignore it until they absolutely can't anymore. Because as much as many you say like lots of them don't, I know lots of them straight up ignore that problem until they are forced to do something about it. So,
Yes.
so what do you think some of the things are that will make them not again, I suppose, yeah, take it a bit more seriously and be a bit more proactive about it?
Yeah, so I suppose first to say is that men, although they get a bad rap for ignoring it, women are also just as bad.
They are, yeah.
So we're sort of equally bad as each other.
Yeah.
But yeah, there's different reasons why men will wait, or the things that encourage men. So men are much more likely if somebody else says you really need to see the doctor. So men will often minimize their symptoms of, is it really as bad as I think it is? Would other people seek help if they had this, or would another man up for a bit longer? It's those sorts of questions that are happening. So often someone close to them, like a friend or family member, encouraging help seeking is usually quite a big tipping point. I guess the point where they just don't feel they're managing, they're losing control there. But yeah, one of the big, often another man, it would be a huge benefit, but sort of adult children or partners tend to be quite good. Also, there's you can go to the doctor and say, well, I don't think I need to be here, but my wife's made me. There's a bit of plausible
classic deflection techniques.
Yes. So that's but that's the sort of the big hitters for I mean, certainly if your medical team said, I think also for encouraging repeat attendance is that validation from your medical team. So a lot of them worry that they'll be wasting the doctor's time or taking up a spot that somebody else worse could be taking. So then when they actually do get through the doors, the validation that yes, so not being fobbed off, yes, it's good that you came. Do
you think there's any barriers to healthcare that men experience other than rheumatologists with firm handshakes or something like that?
Oh, absolutely. So there's the minimizing symptoms is a big. I think also the sort of to a point the feminization of healthcare. So if you think about often you sit in maybe not so much. Now that infection control since COVID has probably tidied everything up, but you sit there and be surrounded by women's magazines, and you've got the receptionist's a woman, and they're quite female spaces. So that in general can just be a barrier in itself. Providing support, often the time of day is quite a big barrier. So often, clinics open or support sessions are run in the daytime, and men can find it hard to get. We particularly sort of blue collar workers can find it hard time off in the middle of the day. So that's often men will often prioritize. The sort of order of priority will often be work. Then when I'm off work, I want time with my family, and then if I've got any time left, then I'll sort my health out.
That sounds about right.
So putting appointments in the evening can be a huge benefit. So if we could, taking men's healthcare to where men are would be the biggest.
Also, I think having to take time off work, again, as we've sort of all that we've said about work, you'd have to almost admit it to work as well, because they may not know, because quite often a lot of workplaces don't know until you tell them about it, of course. But like having to say, I've got a rheumatology appointment or something like that, and I might be gone for a couple of hours.
Absolutely. And interestingly, so in terms when I was looking into designing support for men, is one of the key things that they wanted was an appointment letter. So they had something official so they couldn't just pop off for support. They might be able to come for an official appointment, but it needs to be very much integrated into a key part of their care and not just this added little extra nice thing that but yeah, a lot of men talked about not disclosing. Interestingly, a lot of men in more physical jobs, because they were aware of the insurance implications. So they had disclosed because they knew, my insurance won't cover me if I haven't told the truth. But a lot of men, if they could get away with, if there was a way of not disclosing it. And if they did disclose, then they often gave the absolute bare minimum information and told the minimum amount of people that had to know. It may be worth mentioning sort of barriers to kind of support in terms of like the mental health side of support. I think it's.
I was going to ask you, like,
what do you want to ask it?
No, go carry on. What are the types of support that are available for men?
So at the moment within rheumatology, fairly limited. So that's something I'm working I'm working on. So hopefully we'll see. Hopefully I'll get my get moving on that and put
Yeah,
something.
work faster, Caroline. Come on.
Yes, absolutely. But at the moment, there's nothing specific for men in rheumatology, other than the sort of general. I mean, even I would say general psychological support in rheumatology isn't fantastic, whatever gender you are, and it's something that's a huge gap anyway.
So maybe then we should sort of phrase this like what support just in general is out there for like men or anyone with arthritis, I suppose. We'll stick with men. They can still join other groups as well. So
Yes, absolutely. So
doesn't have to
yeah,
be men only.
support working well for men at the moment, more broadly, men's sort of mental health. Um, Talk Club is a charity worth mentioning. They're fairly young charity, maybe 5, 6 years old now, but really starting to gain traction. They are a talking group that they very much they use a lot of male language in the branding, which seems to really encourage men to take part. So they talk about working on your mental fitness rather than your mental health.
Yeah.
It's like a gym for the mind. So in the way that you'd look after your body, come along and look after your mind. And they sort of go into various pubs or clubs or lots of men's spaces. And the idea is that they ask, how are you out of 10? And then so go around the room, how are you out of 10? Why that number? And then by the time you go around again, what's your number? Which usually the number's gone up because the positive benefit of sharing with each other. And they encourage any men to go along. So you don't have to be having a problem with your mental health to go along. It's just come along and get used to being in a space where we talk. Because often men don't have necessarily those same, aren't as used to talking. They don't have the emotional language that women do. So it's so that's doing incredibly well. They've just started in prisons, which is currently sort of also showing to be very successful and
Excellent
so far. Men's Sheds is the other one that's probably worth a shout out, which is the idea that men support each other best when they work side by side, shoulder to shoulder. So they provide literal sheds and spaces.
Oh yeah, we're big fans of men's sheds here. I've done some stuff with them. We've attended Shed Fest for several years, which
Brilliant.
is their annual conference, which I highly recommend.
So that's definitely recommend a men's shed, and there again UK wide. So find a men's shed near you.
They are good fun. They are good
fantastic.
fun. I got to go to one recently for some work, and yeah, they are really welcoming places.
Absolutely, and very much there's no emphasis on talking but as part of the if you put men in a room together, they will inevitably open up. It's just that's not the reason that they're coming, is the sort of powerful sort of offshoots of that type of idea. So there's men's pie club, which is pretty much the same idea as men's sheds, but everyone sits around and makes pies together.
I'd not heard of that one, but that sounds excellent.
Yes, it's brilliant. Andy's Man Club, you may have heard of. Which
yes, yeah, that's quite a big one, isn't it?
Group. More of the more focused on men that I think they brand it as men going through a storm. So more for those men that are particularly struggling, whereas talk clubs, the more upstream approach of, although they also now have therapy groups that you can attend.
It's interesting the use of how impactful the use of language is in just like things like the marketing materials of that, and how
really
I can absolutely see it making a huge difference.
Absolutely. And calling something, so I've removed all of, if I develop something, it won't be a support session, it will be, information and disease management, or so cutting support, cutting help, cutting all those. In fact, that's what I would like. My sort of aim is to get either talk clubs or versions of talk club that maybe incorporates a bit of the sheds approach into. That's my sort of vision for an intervention that I think would be nice for men, would be to roll those out.
For sure.
But yeah, watch this space.
Oh, we will. Oh yeah,
overnight.
Keep me up to date. I'll let everyone who I know throughout. Yes, also, another thing to mention, we do have like a mental health directory on our website as well. So for if anyone does want to look up, somewhere where you can get some sort of help or support, then have a look on our website. It's a whole link of loads of different places dotted throughout the UK in there as well. I suppose I won't keep you too much longer because and I'm sure you've got lots of stuff to do.
I could talk for hours on it. That's fine.
I mean, do you have any words of advice for men then who are either diagnosed or already living with arthritis?
Oh, good question. I'd say, yeah, I mean, one bit of advice would be don't be afraid to talk to your rheumatologist. Go in with, one of the sort of classic bits of advice for just patients in general is make a list of 3 to 5 points before you go into your appointment, and so that you've got what's important to you going into the consultation rather than and don't be afraid to ask or to talk about your mental health, because I think that's something that, or mental well-being, if it's something that clinicians will often ask more generally, how are you doing? Women are quite much better at interpreting that in the holistic sense of how are you doing generally. Men will very much interpret that as physical health. I'm trying to encourage clinicians to ask much more directly about how is your mental well-being. But until I get that message out to all of them, when they ask generally how are you doing, then they are interested in your overall well-being. So don't be afraid to tell them. And if it helps to take someone in with you to an appointment, like wife or somebody that will kind of make a note of some of these things and advocate for you, then
and to ask if you don't understand things as well, because that's you don't want to appear stupid perhaps in front of the doctor, but you're not a doctor, so don't be worried if you don't understand what the hell they've just said.
Absolutely. And over time you'll become more of an expert than your doctor in your condition. But it's fine at the start not to be.
Yeah, that's one thing. I've had so many people and they've had it explained to them, like, oh, it's this and this. So what do they say? Oh, I don't know what any of that meant. Yeah. Well, now you can't do anything. Like you need to ask these things to understand it. Like,
and if you can't ask the doctor, ask your specialist nurse, because they'll translate for you.
Excellent. Well, thank you so much, Caroline. That's been really, really interesting. I appreciate your time for that. And like I said, if you'd like any more information on the topics we went through today, please do visit our website, and you can find links to that in the episode description below. And if you haven't already, please like, follow, subscribe, whichever of those is appropriate for your preferred platform, so that you don't miss any upcoming episodes. And yeah, thank you so much, Caroline. That's been a real pleasure.
No problem at all. Lovely to chat to you.
And thanks everyone for listening. Bye-bye.